cases of discourse, semantics, and pragmatics deficits in patients with frontomental dementia and Alzheimer's disease. This study aims to assess patients with behavioral variant frontomental dementia or Alzheimer's disease and their ability to find meaning in sentences through semantics and pragmatics. Past research has focused on single words and sentences that do not require context. Far less research has been done on the neurocognitive ability of semantics and pragmatics on neurological patients. The goal of this research is to determine if behavioral variant frontomental dementia or Alzheimer's disease have effects on figurative language, humor, comprehension of indirect requests, and conversational interruption.
Research question and hypothesis. What are the different levels of impairment between AD and BVFTD patients in areas of language comprehension skills, idioms, inferences, indirect requests, and humor? Idiom comprehension may be impaired in AD and BVFTD. BVFTD patients may have increased difficulty in discourse inference tasks than AD patients and controls. Interpretation of indirect requests or replies may be impaired in both AD and BVFTD patients. BVFTD will have the most difficulty compared to AD and control patients in understanding humorous stimuli. Methods. 3 groups of participants were enrolled in the study: Alzheimer's disease, AD patients, patients with behavioral variant frontotemporal dementia, BVFTD, and healthy controls. All participants chosen for the study were considered to have mild cases. Certain groups were excluded from the study, such as those who experience everyday language difficulties pertaining to phonology, syntax, and semantics. A total of 81 participants were enrolled, 24 with BVFTD, 25 AD, and 32 healthy individuals. Each participant received a PET scan, position emission tomography, and took multiple tests: general neuropsychological assessment, discourse semantics and pragmatics battery, idiom comprehension, request comprehension, discourse inferences, and humor comprehension.
Author's findings. In general, BVFTD and AD patients experience similar impairments in idiom and request comprehension tasks compared to the control group. BVFTD patients made more errors in discourse and humor comprehension than both the AD and control groups. PET scans showed greater damage in frontal and temporal regions in BVFTD patients and posterior temporal and parietal regions in AD patients. What do the findings mean? BVFTD patients may have a harder time making correct inferences about incoming speech and in the ability to suppress contextually inappropriate responses than AD patients. AD and BVFTD patients may have differing areas of the brain that are damaged during the progression of their condition, leading to specific and differing impairments. Discussion question. Do you think there may be other coexisting factors as to why participants scored differently?